We are the first to report tonight on a new study into the misuse and theft of opioids by doctors, nurses, and other healthcare workers. It is called opioid diversion, and it's helping to fuel the epidemic. More than 47 million prescription doses were stolen last year. Here's Errol Barnett.
I was jaundiced. I was very fatigued. It knocked me out.
When Lauren Lillini went to the hospital for kidney surgery in 2009, she was shocked when left with hepatitis C and a liver infection.
My life dramatically changed because now I am a 40-year-old woman with a 1-year-old daughter who is so fatigued and can't work.
Hospital technician Kristen Parker infected Lillini and at least 18 others by stealing their pain medication, then leaving contaminated syringes for reuse. She's now serving 30 years in jail.
She was taking them off surgical trays, using them for herself, her own use, and then filling them with saline and putting them back on trays.
A new report out on Tuesday, released by data firm Protenus, finds that this so-called opioid diversion is a growing problem. In 2018, more than 47 million doses of legally prescribed opioids was stolen, an increase of 126% from the year before. And 67% of the time, doctors and nurses are responsible.
Me doing this interview with you, most of my colleagues will think I've lost my mind.
Dr. Stephen Lloyd of Tennessee was one of them.
What I didn't realize was how quickly it would escalate, going from that half of a 5 milligram Lortab to within 3 years about 500 milligrams of OxyContin a day. It's about 100 Vicodin.
For 3.5 years, he siphoned drugs away from his patients.
So you write a new prescription for someone and you take what they've come in with.
There was no requirements on what happened to those pills. They could go down the toilet or they could go in my pocket.
He's now been clean for 15 years and was the director of Tennessee's Mental Health and Substance Abuse Services Division. He implores addicted healthcare workers to admit they need help, which for him was the hardest part.
I'm going to lose my job. I'm going to lose my wife. I'm going to lose my cars.
Until he was confronted by his own father.
He said, none of those things are going to do you any good if you're dead.
And Dr. Lloyd warns that more doctors are likely high at work caring for patients than we realize. The Department of Justice launched an opioid addiction detection unit to combat all of this. But, Jeff, it was established in less than a third of the country, so a major issue that still needs to be dealt with.
And a story that makes you mad. All right, Errol, thank you very much.